It is Vanessa Enoch with The Doctors Are in the House. We are live today with Dr. Chike Obioha, who is going to be speaking about the truth about wounds. And so, if you are a diabetic or one of your loved ones is a diabetic, you're going to want to hear what he has to say today. Um, we are going to first start out by playing a short advertisement, and then we will have a conversation with Dr. Obioha. We're going to allow him to first talk to us about wound care, and then we'll be able to ask him some questions. So if you have a question, please feel free to put your questions in the chat. Dr. Obioha will be able to see those as well as myself. And so let's go ahead with the advertisement and then we can get started.
Do you have an open, non-healing wound from surgical treatment, bed sore, diabetes, or poor circulation, and you've been told to have your foot or leg amputated due to a bone infection? Don't you really deserve a second opinion? You may want a consultation with a doctor at St. Richard's Clinic on Socialville Foster Road in Mason, with decades of wound care experience. In addition to treating work-related injuries, St. Richard's Clinic also provides neighborly primary and urgent care services, with scheduled appointments, walk-ins, and telehealth visits. St. Richard's Clinic is currently accepting new patients and accepts most health insurance plans. St. Richard's Clinic is open Monday through Friday, 9 to 5, and Saturday by appointment. Schedule with St. Richard's Clinic online or call 513-306-4910. That's 513-306-4910.
Well, again, welcome everyone, everyone who is listening live and everyone who will listen to the recording of this. We are here with Dr. Chike Obioha, and Dr. Obioha is a physician in the greater Cincinnati area. His clinic, St. Richard's Clinic, is in Mason, Ohio, and he is accepting new patients. And so if you're interested in seeing Dr. Obioha, the phone number is streaming across the bottom of your screen. It's St. Richard's Clinic, 513-306-4910, or you can visit St. Richard's Clinics with an S on the end, strichardsclinics.com. Well, Dr. Obioha, we are excited to have you with us this evening, and even more excited to hear what you have to say about wound care. And so, Dr. Obioha, can we start by just you telling us a little bit about yourself? Tell us about your background and what your areas of specialty are, and then we can get into your presentation.
Okay, just quickly, I'm a trained surgeon who decided to venture into public health and occupational medicine with primary preventive care. And in the last 8 years, I've utilized both skills to improve the outcome of wound healing in the Hamilton area, working at Fort Hamilton Hospital, and have demonstrable success with wound healing, especially diabetic foot ulcers, to show for it. I want to welcome you all back to this conversation we had. This is the second time we're having this conversation. The first one was in my office, and this one is from the library. I'll use the opportunity to use a PowerPoint to just showcase one of my patients that benefited from the quality of care we provide. This patient, when we roll the tapes, you see was asked to lose his foot 3 or 4 months ago, and we'll give you a sequential update on the wound healing process and his activities up to the last time we saw him, which was yesterday. So briefly, we mentioned what diabetes is. It's the commonest thing that creates a reason for people to spend money in the healthcare system. When you look at the healthcare budget, the diabetic foot ulcer has the giant component of it. And that's why we just kind of target this topic to address why you should not ignore that wound, in this series of talks we're having. So I will just go straight. I just showed up the anatomy of the foot. It may just look like something you see on Google, but I need to point out some key things about the structure of the foot. can actually compare the foot to a bridge. You can see the two ends of it. So you have a medial arch, you have a lateral arch, and you have a transverse arch that defines that foot. One of the things diabetes does is it weakens the architecture and causes a flattening of those arches. And that is part of one of the things that you find clinically when you see these patients. They have all sorts of foot deformities, the ones that you think you only see in a newborn, like clubfoot. You can have that from abnormalities that arise from that. You can have calluses, and ulcers ultimately. And the ulcers are described as one of those perfect storm where you have a patient whose foot is not doing well, but he has to move around. So he constantly causes injury to that foot. The patient is not able to hold back infections in his system because of his diabetes. And then, because he's unable to do that, it means that the infections can easily have their field day with him. And then he has the neurologic problems, he has the vascular problems, and then he just has all these challenges that seem to be overwhelming. Now, don't get me wrong, our healthcare system is highly advanced, it's so subspecialized in recent times. But the challenge with that is the subspecialties do not communicate. If you've been in the system, you know that the primary care person sees you is trying to control your weight, for instance, or control your diabetes. He sees a problem, your foot is sent you to the foot doctor. The foot doctor doesn't speak back to the primary care person. He just says, oh, there's a problem there that needs to be cut off. He goes and does some surgery there without considering that it was the problems that the primary care person is trying to fix that has generated that problem. So he is now creating a new problem on top of the one that created the original problem. And ultimately, that leads to limb loss. And that's where we come in. We're able to work with your primary care if you choose to keep them, or we can actually provide primary care services for you to make sure that all these things come together and give you a limb like the patient we're going to present in just a bit. So I'd like you to go ahead and so conflict of interest disclosure, I don't have any. I'm just presenting a patient I treated with the patient's consent. Now, the pictures that I just showed you were from Google Images on the foot anatomy. It's available to anyone who chooses to look. I just wanted to highlight some of the key features of the foot generally. So next slide. So we're going to our patient. So this, you can see the date on there. This patient had a burn injury, on by the time we've seen him the first time, the date is on there, which is February 26th. And the thing has happened about 2-3 weeks earlier. And he felt it was something that was just going to go away. Well, you can see the earlier date on 2/21 was when it looked like it was something that was just going to go away. It just kept turning dark, and by 26, it was now becoming a little bit scary. And there was you can see some new redness in that area. So as we move to the next month, you can see how bad things have become for him. I had seen him, I think, somewhere about this time, and it became obvious to me that he had severe arterial insufficiency. But when we did his imaging, it turned out that he was almost 90 to close to 100% occluded at the level of his, where the vessel behind his knee, let me not use big anatomical terms. The vessel behind his knee was almost completely occluded, and the circulation was poor. And now you can see the features he has. You have a purple-looking limb there with black tissue in the middle of the wound, which may be from burn or can be from tissue necrosis as a result of his arterial insufficiency. And then you have swelling of the limb. So at this point, he was offered amputation of his limb. And then somebody told him to come to me, and then we'll take it from there. You can see how swollen his foot is. And then at the time we started treating, you can see by the next month, he starts looking back. The swelling is fairly controlled. The redness around the wound seems to have improved with our care. And on this date, 4/23, you can see the difference between how we improved the wound on 4/22 and what had happened on 4/23. 4/23 is that he had left us temporarily and somebody put a compression wrap on there and then worsened the ischemia. And then I think I had left the clinic around about this time. I moved to St. Richard's Clinic where he ultimately saw me again, and then we went on. So we just keep rolling the tape. Next slide. By May, I left the I left the hospital, the other hospital, about 2, 3 weeks before this encounter here in May. I opened the St. Richard's Clinic on the 1st of May. So the patient actually found me before the clinic opened and kept calling. And I told him I didn't have anywhere to see him. I had to wait till I had an office or somewhere before we could get started again. And then he comes right back. So in May, on the May 14th, you can see how we went back trying to get the wound to look better, just because he didn't want to lose this. By the way, the gentleman is a retired, I think he worked in the law enforcement, and he enjoys fishing quite a bit. He's a very active young man, living a wonderful love life, and would prefer to keep his limb. Like I appeal to those who want to keep their limbs. You know who to meet and where to get help, and you definitely can tell the story of this gentleman. So 14th of May, 20th of May, 23rd, you can see the pictures to show how he started generating healthy tissue around the wound there, and the tendons that are exposed, you can see they even turn a little dark as we're seeing him on the 20th, but we'll be able to clean out those tendons and get granulation tissue to cover up those tendons and save them from being lost, so that the function of that tendon and the muscle that connects them is maintained as we get him moving. So move the next slide. By next time we saw, by the time we move to the next month, you just continue to see improvement in his wound. We'll continue to see improvement in his wound as we go along. So let's move the slide again. So at this point, it was time to, we've controlled infection, control swelling, improve the microcirculation around the wound, and we're getting wound healing. You can see at this point, he has 1, 2, 3, 4 wounds. It was certain that anyone who saw this leg would want to cut it off, but we chose not to do that. We chose to improve on those modalities that were not helping the wounds heal and get them to heal. And you will see that it's not a joke, it's something that actually we're able to achieve as we roll the tape. So move from May to the next month. So the later part of May, he starts having much more healthy looking limb. The wounds still making progress in terms of reduction in size, in terms of improved granulation tissue, reduced swelling, and wound healing progression. So we move on. Sorry, just to point out, the wounds were on his anterior left ankle, you can see. And he also has a wound on the lateral aspect of that left foot. And then he has wounds on the ankle posteriorly and also on the left heel posteriorly. So some of them are pressure injuries. Most of them are burn wounds from exposure to thermal burn. So we roll the tape. And at this point, just watch the quality of wound as we address this person's wound. And in no time, he lost a few wounds. The wounds on the back, you see, quickly went away. The ones on the posterior ankle and the heel went away. The other one kept improving, and you could see the granulation tissue in that slide there is now covering the exposed tendon. And you don't so much have black tissue on the tendon anymore, which was one of the reasons that they had convinced him he needed to lose that limb. So we move again from May, we move into June, and by June, you can see at least as we move from June 6/4 to 6/17 to 6/23, 6/25. We're having less and less exposed deep tissue like the tendon, more and more improved granulation tissue, better patient in terms of symptom control. His pain was less. By this time, I had started him on physical therapy with the strategy to increase the range of motion around that ankle joint, as well as increase the muscle strengthening activities around that joint. So at this point, we were able to start getting him to ambulate. So this young man wasn't able to walk on those legs. So we started getting him through the coordination with physical therapy. We get him to put the foot down and ambulate with a frame and continue the physical therapy. So you can see coordination of care among different specialties to achieve the result that we want done at St. Richard's Clinic, where I currently provide service. So we'll move on to the next one. So as we move on, you can see the wound on the back is now completely gone. The ones on the posterior ankle and the heel is no longer there. And then by June 2nd, you can see how much smaller the wound on the lateral foot is. The foot on the wound on the ankle keeps getting better. You barely can recognize any exposed tendon there. It's good granulation tissue covering most of the wound. The wound depth is lost, and the skin there looks better. All these improvements in the wound go with improvement in symptoms. The patient is able to ambulate, to use his legs the way he wanted, and he can see the improvement in both his symptoms and wound healing progression. So we wrote it down, moved again. So as you move through the month of June, you will see how much we're losing. So we have two wounds left. The big wound on the anterior ankle. Ultimately, we will see the wound shrink into two different wounds, cutting the wound into two due to healing process, but we'll have that to show. And you will see the the other remaining wound also looking better as we move on. So we move from to 16, and the pictures tell the story. You can see. So move to the next slide. So at this point, you can see how much healing has taken place, and we now need some kind of substitution to support the healing process, because most of the healing that is supported from the tissue around the wound has been exhausted with this amount of healing. So at this point, we start discussing the possibility of skin substitute or skin graft, which we provide both at the clinic, and then he prefers the substitution, which takes a longer process to get it. But this is the time to put a graft on that wound and expect that within weeks the graft takes and the patient should be healed and out. And then he's able to, you can see what I was pointing out about the wound separating. So the center of the central area of that anterior ankle on the left has healed, leaving you with what was once a single wound becoming one tiny wound on the lateral aspect and a little bigger wound on the medial aspect. And that progression continued throughout the month of July. And then the last time, so this is July 2nd pictures showing us how the wound healing progression has continued to go. And you can see the wound on the lateral foot is almost gone compared to the original pictures that we had. So move us through the month of July. So I put a picture here to show when we started putting the skin substitute. We chose a placental product for his skin substitution here, and then that is applied in this. I think maybe the first application was on the 9th of July, because the wound is now ready for that quality of advanced care. Roll the slide. So we've applied that, and then you see subsequently the wounds are much smaller and just waiting to be healed. And then move further, and this is the last time we saw him, which was yesterday. You can see how much better the wound looks. And in the next couple of weeks, or a little more than that, I think this wound should be over with. And we have a gentleman who can walk, live his life the way. So just wanted to show you an example of what we're capable of doing. Now, if you go back to where I had worked, you see a truckload of patients with similar problems who were taken care of. And it's all about assessment, recognition of the challenge of the wound, recognition of the patient's challenge, coordinating care to make sure the patient walks out with diabetic foot ulcer from blood flow, whatever the ulcer is that we can fix. You will be able to walk with us and see it get fixed. I appreciate the opportunity to present this patient and give you more conversation about what we're able to do with this problem. And I'll welcome any questions to just address the issue at hand.
Well, wonderful, wonderful, wonderful. And so, Dr. Obioha has opened the floor. So, for anybody who is currently watching, if you have any questions of Dr. Obioha, please feel free to ask any questions you might have. As he is here, he is here and able to answer those questions tonight. But also, if you have an issue, a wound that you need care for, or any medical issue, Dr. Obioha has a practice in Mason, Ohio, at St. Richard's Clinic. The phone number at St. Richard's is scrolling across your screen. It is 513-306-4910. Again, he is in Mason, Ohio. And the website is strichardsclinics.com. That's St. Richard's Clinics with an S on the end.com. And I mean, I'll tell you what, one of the things that um, I was just amazed by is the fact that with someone with a wound that serious is able to save their limb, that you don't have to lose a limb simply because you are a diabetic and you have a wound. I've heard many people, in fact, my own grandmother had to have her leg amputated in the later stages of her life as a result of being a diabetic. And I have many uh, friends that I know whose parents have lost a limb. And so I was excited when I spoke with Dr. Obioha, and he shared with me the possibility of being able to rescue the limb. And I think that in and of itself is enough to render a drive to Ohio and a visit to his practice. If you are ever told, if you're outside of Ohio and you're ever told that you have to lose a limb, he is a doctor who cares and who is willing to go the extra mile to make sure that you don't have to have an unnecessary amputation just because you have a wound. So let me
That's a couple of
return Dr. Obioha to the stage. Did you have you had
just
something?
a couple of things. We are living in very interesting times where our social support structure system and healthcare has become a budgetary challenge. I mean, if you followed the news lately, you know that those have become available for adjustments in the budgetary system. So the onus is on us to just recognize that we need to take better care of ourselves. If you don't have a social support structure, it means you got to get out there and work. I think you're better off with your limb if you want to be able to provide some job that is compensable. So if you need to take care of your limb, take advantage of the opportunity and just make sure you do that. Today, there has been so much improvement in wound healing that I can almost assure you that we literally can heal most things. It's just rare to get a situation where you're not able to heal it. You know, to keep in mind the what we call the indications for amputation. If a limb is dangerous to you, if it's dead clearly, or is deadly, those are the reasons why you would consider losing a limb. Deadly, you have a cancer there that is about to kill you. I would not stop that from being taken off if you want to live your life. If you have a already dead limb that there's no life in it, that will be a reason. But my experience is most limbs don't hit the threshold that deserves to be cut off. And most people end up with living a life that is not as fulfilled as they would have loved just because someone told them that they needed to lose their limbs. Mine is seek a second opinion, ask somebody else and see if something can be done about it. Today we have the hyperbaric oxygen, we have all sorts of skin substitution products, and we still have the basic surgery of skin flaps and skin grafts that we can do to salvage a limb. We have the best interventional vascular procedures around, and people who can provide them. We have vascular surgeons who can revascularize limbs, who can put the patient in a hyperbaric chamber and ensure that the limb is oxygenated ahead of the surgery to correct whatever is blocking the circulation if we have the window of opportunity to do that. So there is so much out there that should save a limb. And I don't mean to sound cruel, but it is profitable to the hospital if you lose your limb. So if you put yourself in the position of the hospital, you'll realize that they'll rather you lose that limb and make the money than save it. We're on the other end trying to make sure that you get a better care. And that's why I'm getting this message across to you, make you know that, look, No matter what someone says about you losing your limb or dying, because they can just ask somebody else and see if the person has a better option in terms of saving the limb.
So, Dr. Obioha, let me just ask a few questions.
Yeah.
So, at what point should someone seek immediate medical attention for a wound, diabetic or otherwise?
So diabetes is a peculiar one. You need to really seek help right away, because the challenge with the diabetes is it depends on where the diabetes is that would determine the direction of the wound. What I mean is, if your diabetes is not well controlled, and diabetes has a component to generating that wound. So the way I explain it to my patients is, if you were in a house that is burning and you suffer a burn injury, nobody will go into the burning house and put a band-aid over you. They have to move you out of the burning house, make sure you're fine before they treat the wound. So think of it that the burn is what is causing the wound in a burning house. So if diabetes is causing the wound, it's like the house burning. You got to move the patient out of the diabetes by controlling it to be able to get ahead of treating the wound. It's just the way it is. It's just the basic principle. If you are run over by a car on the highway, I don't imagine anybody will go there and start trying to treat the wound that you have sustained. They got to move you out of the highway so that you don't have to suffer additional injuries in the process. And then once you are stabilized from the injuries that could take your life, then anybody can go ahead and try to address the wound problem. It's the same principle that appears in diabetes. The problem with diabetes is nobody's willing to look at it in the same way as all the other wounds that have a definite cause, etiology kind of relationship. So once you look at things from that same perspective, you develop a concept of better taking care of the diabetes. But like I said, the healthcare system is so sub-specialized that people don't communicate. Your primary care is seeing you for your diabetes, is controlling it. The food doctor is seeing you for just the food. He's ready to cut it off once he sees something there without even asking the primary care whether your diabetes is controlled enough to have that. So you end up having one surgery, second surgery, ultimately just keep chipping out pieces of your limb until you don't have any limbs left. That's what I'm saying. That's where St. Richard's comes in. We work with your primary care, who can provide primary care for you to make sure that all those things come together to give you the optimal in terms of outcome to avoid losing that limb.
So, what are the red flags like discoloration, discharge, odor that indicate possible infection or tissue damage?
Well, you just said it. Those are local symptoms. The person can also have systemic symptoms. Another thing about diabetes to be concerned about is the systemic symptoms that you see in a normal person, you may not find in a diabetic, because diabetic's response to infection is modulated by the disease itself, especially if it's poorly controlled. So those are things we're able to recognize that, hey, while somebody who is non-diabetic will look like he needs to be admitted in the ICU with the symptoms that he's having, the diabetic will just look like everything is fine until it crashes, and then you start struggling to keep that person alive. So if you've been in the practice, you know what to do. You know how to recognize that something is not right here. You know when to go to a more aggressive antibiotic treatment if it's necessary. Bring in other specialties like infectious disease if it's necessary to make sure that you combat the infection and get a better outcome, and ultimately save the limb, so that at the end of the day, the person has better control diabetes, save the limb, and we can get the person back in the workforce.
So,
Just like I have said in the beginning of, you want to get you quickly and out of the system and back functioning as much as possible.
so what can happen if treatment is delayed, and how can early intervention change outcomes?
The delayed treatment can be the line between a saved limb and a lost limb. Can actually be the line between a life and a lost life, or a prolonged hospital admission and all that. So the earlier the intervention, the earlier you can quickly address the problems in hand, get ahead of them, and get the person on the better side. Delayed treatment, like you saw in the gentleman, we are counting we've gone past 6 months with his wound, despite his commitment in trying to heal it. But if that was attacked earlier, the gentleman I presented, you could have had a much quicker outcome. Outcome, it wouldn't be as delayed. But like I said, even with his limitations, he had poor circulation, he had delayed presentation. We were able to still articulate his problem, figure out what he needed to be done, and get him healed. I'm counting that out. Next time, if I was to show you another presentation, that limb would have completely healed and he's discharged from the clinic. But if you see the progression of the wound, then it actually tells the story. So the earlier the intervention, the better in terms of outcome, the better in terms of how quickly, and it reduces the duration of time the person stays in the hospital system, ultimately saves the cost and gives you a better outcome.
Well, let me say this. First of all, as you may already know, Dr. Obioha, VisionWorks is a workforce development organization. So we are particularly concerned with occupational medicine and lifestyle integration. And so let me ask you, how do work environments, especially those on their feet all day, affect wound healing in diabetic patients?
That's a wonderful question. So that is just a wonderful question. Yes, for a diabetic, especially a diabetic foot problem, standing, if your work requires you standing, sitting, or walking, you increase the orthostatic pressure that ultimately causes swelling in the limbs, especially if you are at least middle age or higher. The tendency to have leg swelling is pronounced because of the orthostasis of standing, sitting, or walking. And with the diabetic problems we've described the nerve damage, deformity in the limb architecture, poor circulation, poor ability to fight infections. All those become multiplied. Just imagine where there is bacteria already and there is now swelling with this fluid. The fluid is actually having constituents that have digested products. That means it's teeming with a lot of nourishment for bacteria. So that mere fact that you're standing and increasing the swelling in your limb is nourishing the bacteria that wants to fight you, to want to infect you, and you're diabetic and you don't have a good immune system to counter that. So it kind of doubles the effect. And then keep in mind, the more the size of swelling your limbs have, it keeps the wound from healing because the wound is not getting smaller because your leg is stretching it, making it bigger. All that has to be considered in being able to control the swelling in the limb, control that drainage that is pouring out of the wound due to the swelling that is there from edema. And then all that needs to be controlled in order to get ahead of the wound that you have in the foot if you're diabetic. Sometimes we may even have to limit how much work you do. That's why it's better to see someone like me who is an occupational medicine physician who knows how to dial your occupational challenges with your PCP or do be your PCP and dial it appropriately and get you moving. Now, I'm a trained surgeon who went ahead to do occupational medicine and, as advanced training. That gives me the added advantage to know to address your surgical problems and get you back to work. That's why we invite you to St. Joseph's Clinic to enjoy the experience. It's kind of like having a buffer of physicians looking at you and making sure that you're good with your problem.
So, Dr. Obioha, we're going to come back after a short commercial break and talk more about wound care.
Okay.
But before we go, I just want to mention again to the audience that this program is sponsored by VisionWorks Inc. And VisionWorks, we provide workforce development and workforce development training for anybody who is out of work, looking for work, and needs assistance getting back into the workplace. We are a United Way funded agency, and we are looking forward to the opportunity to serve you. So if you're interested in getting some assistance with getting back into the workplace, our life coaches can assist with that. But I'm just going to take a short commercial break and let me go ahead and.
Do you have an open, non healing wound from surgical treatment? Bed sore, diabetes, or poor circulation? And you've been told to have your foot or leg amputated due to a bone infection? Don't you really deserve a second opinion? You may want a consultation with a doctor at St. Richard's Clinic on Socialville Foster Road in Mason, with decades of wound care experience. In addition to treating work-related injuries, St. Richard's Clinic also provides neighborly primary and urgent care services, with scheduled appointments, walk-ins, and telehealth visits. St. Richard's Clinic is currently accepting new patients and accepts most health insurance plans. St. Richard's Clinic is open Monday through Friday, 9 to 5, and Saturday by appointment. Schedule with St. Richard's Clinic online or call 513-306-4910. That's 513-306-4910.
All right, a short commercial break. As I promised, we are back. And Dr. Obioha, I have several other questions that I want to ask you. And of course, if anyone who is watching this broadcast, we're streaming it on Facebook, YouTube, and LinkedIn. Anybody who is watching this broadcast, please feel free to chime in and ask any questions you might have. Um, but Dr. Obioha, can you share how occupational medicine intersects with wound care in terms of prevention and long-term health care planning, health planning?
Well, wonderful question. So, wounds can come from work. Work can be limited by wounds. So, how do you get wounded at work? That's where we specialize. Well, wounds is not all ulcers. You can sprain your shoulder from carrying something at work. You can hurt your hip, like most nurses do, by lifting heavy patients when the facility does not provide them with appropriate equipment to do that. You can hurt your knees if you have to kneel down to do whatever work you need to do. I've talked about swelling of the legs that can be as bad as to rupture into a wound, depending on how much you have to stand at work. So different activities at work can provide a wound itself, and then can also challenge the wound. And then the question is, if you had wound, assuming you're not at work, you're at home and you have injured yourself, are you able to get back to work and provide your work service the way it's designed with your wound? That's where we come in. We make assessments of whether you can do that work or you need a break from work to be able to get healed and be able to return back to the workforce. I just can't emphasize that any much more how important it is. Now, the question arises, if you decide not to seek our recommendation and just go back to work and start doing the work. Just imagine someone who works in a meat factory line, is cutting the meat and slashes their finger, and just tries to kind of find a way to manage it and still keep doing the work. Now, it runs the risk of infecting that wound, infecting the very meat products that are going out to the market to feed several people and supermarkets. It runs a catastrophic outcome of the limb that has been hurt. Now, that's where we come in and take the person out of the work to prevent that from happening. Now, such wounds are at risk of having a tetanus or something get into the wound because of the nature of the instrument that may have caused the wound. It may not be a very clean instrument. And then the environment also tells about what could easily challenge the wound right away. There cannot be a better person to meet if you have a wound at work than someone who knows wound and knows work. That's what St. Richard's Clinic offers.
Okay, again, I am speaking with Dr. Chike Obioha. Dr. Obioha has a practice, St. Richard's Clinic, in the Mason area in Ohio. That's in the greater Cincinnati area in Mason, Ohio. The phone number, if you want to reach Dr. Obioha, is 513-306-4910. He can also be found on the internet at St. Richard's Clinics with an S on the end.com. St. Richard's Clinics.com. Again, 513-306-4910. And I, again, am Dr. Vanessa Enoch. I am not a medical doctor, and I don't play one on TV. But I am here speaking with Dr. Obioha as we provide Vision Works. We provide workforce development solutions for people who are looking for work. And so, Dr. Obioha, as we're talking about patient care and access to patient care, what are the biggest challenges patients face in accessing proper wound care, especially in lower income and rural communities?
And that's a very wonderful question. So I think the first big challenge is ignorance. If you are aware, then you can seek. If you can seek, then there's a good chance you will get the care. So by providing what I'm providing right now, which is information to the general public for free about what they need to do when they have injury at work and where to go to get the help. Those are ways to enlighten yourself, empower yourself, that you should be able to take advantage of what is around you. You have a phone, you can make a call, ask someone for help. If that person cannot help you directly, you can call for an ambulance to pick you up if things sound on the phone like they are quite daring as far as your life or situation is involved. Those are kind of the most empowering things to know what to do. If you have a dog bite, for instance, most people will just put the oil on it and just. Now, dog bite or human bite, those are things that really can knock you out once the infection in the mouth of the dog or the human starts getting into your circulation. Those are, like I said, this forum gives me room to talk to a broader audience and let them know the real reality of some of the simple things they ignore at home as far as wound is concerned, and how it can suddenly change to a life-threatening event or prolonged admission in a hospital or have illnesses that fall out of it that can just change the outcome of the way you live your life. These are real economic times. These are times when the economics and budget is now challenging our uh, social structures that help that way, social support structures, and also challenge the healthcare that is easily available to those of us who are handicapped. So why do you want to join the handicapped group when they are beginning to be a burden to the national budget? So as much as possible, take advantage of what is available to you and keep away from being handicapped and needing help when you can just get out there and make a living for yourself.
So, how is St. Richard's Clinic addressing these gaps in preventative and ongoing care?
Well, trying to educate the general population by what I'm doing. This is the second in a series of the new set of talks that are just going on between me and the social media. And there's a lot more talks are going to come down the line talking about the occupational challenges in our system, and then how you bridge the gap so that you are a more healthy worker. We talked about preventive medicine, where we make sure that your vaccinations are appropriate. If you require some kind of gadgets or what we call appropriate material to work with, we counsel you towards using that in your small businesses or where you work if they are not aware. And those are things that keep you safe and healthy doing the work you do and help you get through this life with minimal handicap and limitation if you have a healthy life.
So, Dr. Obioha, you mentioned vaccinations.
Yes.
Do you provide vaccinations at your clinic?
So we intend to, but at this point, the thing about vaccination is one, knowing the ones that you are that it has been recommended for you, and then knowing where to get it. So most of the vaccinations we recommend go to this place and get it. When I worked in the hospital setting, even there were some limitations about getting vaccination in the wound clinic, we still had to refer the patients to their primary care providers or other facilities to get vaccination. I'm working up my staff currently to get them well integrated with the vaccination thing. I won't tell you that we're doing vaccination at this point, but we can refer you to the available facilities where you can get vaccinations done at the minimal or zero price or cost to you.
Wonderful. Well,
Yeah.
well, Dr. Obioha, it looks like we are at the 7:45 mark. Well, we're 1 minute beyond that mark. And so we are out of time.
Okay.
But I just want to say thank you so much for being here today. And as Dr. Obioha mentioned, we will be doing a series of discussions on various topics, and we will be posting to whatever venue you're watching these on right now. We will be posting this live on that venue. And so please come back, share this broadcast with somebody you love and care for, who you want to make sure that they are able to take care of their health. And we look forward to having more of these conversations. But before we go, I do want to again tell you that St. Richard's St. Richard's Clinic is located in the Mason, Ohio area. The phone number for St. Richard's Clinic is 513-306-4910. You can also find Dr. Obioha and St. Richard's Clinics online at strichardsclinics.com. That's clinics with an S on the end, strichardsclinics.com. And if you have any questions about any health related issue, Dr. Chike Obioha would be happy to answer those questions. Otherwise, again, I am Dr. Vanessa Enoch, and this is The Doctors Are in the House. And we will continue having additional discussions. I'll be posting those topics at least 2 or 3 days in advance to make sure that you know what we're going to be talking about. So do please come back to whatever venue you're watching this on and check us out. And as always, if you have questions when we're doing the live broadcast, you can feel free to ask those questions online. And we look forward to having additional conversations in the future. I bid you a wonderful evening tonight. And again, thank you, Dr. Obioha, for being with us tonight. And guys, go see him, and we'll see you all soon.
Thank you all very much for taking the time. Appreciate it.